Hi, I'm Dr. Syed Tousheed, consultant pulmonologist from Narayana Health City, Bangalore. Today I will be discussing about an important topic called as pulmonary embolism. What exactly is this pulmonary embolism? It is nothing but the clot, usually a blood clot, which gets lodged in the blood vessels supplying the lungs, called as the pulmonary arteries. Basically, it is a clot in the pulmonary vessels. From where do you get this clot? Usually this clot gets formed in the lower extremities, that is in the legs or in the pelvic veins. Once it gets formed, sometimes it can get dislodged, and from there it moves ahead and it goes to the circulation and it gets trapped in the lungs. Lungs usually behave as a sieve, so it doesn't allow anything to pass through it. So this clot gets stuck over there. Sometimes this clot, if it is not treated, it gets organized. Once it gets organized, it causes obstruction to the blood flow further ahead. So because of this, the pressure starts building up and the patient starts having pulmonary hypertension. So the pressure increases and hence there will be strain on the right side of the heart. So ultimately, the patient will start experiencing breathlessness, and finally, because of the right-sided strain, patient can go into right-sided heart failure, which can lead to swelling of the lower limbs, face swelling, all this. So who can get this pulmonary embolism? Any one of us can be at risk of developing pulmonary embolism, but it is more common when you are immobilized. That means you don't move for a very long time. So be careful, especially when you are traveling in flights, that is in economy classes, where you don't have enough space to move your limbs. So you should be very careful when you are traveling for a long time, more than 8 hours. You need to keep moving your feet when you are in these kind of journeys. And also, especially in this summer, when you are dehydrated, you can get this clot in the lower limbs, which can further lead to pulmonary embolism. There are various other conditions which can increase the viscosity of the blood and decrease your water content in your blood, and that can lead to clotting. So other common causes are cancers. When you have unexplained clots in your lower limbs or in your pulmonary circulation, then you should think of malignancies in this. Though it is detrimental, how do you pick it up? Most of the time it is clinical judgment. So you see a patient who comes with breathlessness and you don't get any signs and most of your reports are normal. That is the time you think that patient must be having pulmonary embolism. So how do you diagnose it? We do a simple CT scan. There's something called as perfusion scan also. In CT scan, we have a specialized CT scan called as a CT pulmonary angiogram. So how do you treat this? So like in heart attacks, where there's a clot in the coronary arteries, we also treat this pulmonary embolism. So based on the severity, if it is severe, we thrombolize it. That means we give injections which can thin your blood out and lyse the clot. Or if it is less severe, we just give some medication which will keep your blood thin to a desired level. So if it is chronic, that means, as I said earlier, that if it is organized, the pressure builds up and can lead to pulmonary hypertension. In these cases, we need to operate the patient. That is called as the pulmonary endarterectomy. So be careful about this pulmonary embolism, especially when you are in a flight which has a journey of more than 8 hours and in summers. And if you have any further doubt, you can contact us. And also, I think we are one of the largest centers in pulmonary endarterectomies, that is the surgery involved in pulmonary embolism. Thanks.